Hello, my name is Georgina Lowen and welcome to the Waltham Forest's Early Years Training on the Progress Check at Age 2. This webinar will support practitioners working with 2-year-olds in settings and schools to develop a deeper understanding of the statutory Progress Check at Age 2. We'll be exploring what the Progress Check is, its aims, and share Waltham Forest's performers and supporting guidance documents that are found on the Hub. We'll explore assessing in partnership, so considering the importance of working in partnership with parents and carers and other professionals. We'll be thinking about early identification and intervention, so we know that the quality of a child's early experiences is vital for their future success. And it's recognised that, for example, speech and language barriers for children at an early age can create difficulties as they move through the education systems and into adulthood. We'll also be exploring effective target setting, so considering how to ensure appropriate interventions and support are in place for children and their families where needed, and that parents are empowered to support their child's learning and development at home. And we'll also reflect on what's going well and what we need to do next. So do our progress checks present a clear picture of what the child can do, their interests, achievements and needs, and our actions in the progress checks acted upon. So what is the progress check and what do I need to do? The progress check is statutory, so settings are required to supply parents and carers with short written summary of their child's development in the prime areas between 24 and 36 months. However, due to restrictions or requirements related to COVID-19, disapplications may apply. So we'd advise you to continue to follow the latest government guidelines where this is the case. The check needs to focus on what the child can do, their strengths and needs, identify areas where progress is slower than expected. So it's important to highlight that discussions around learning and development should be part of an ongoing dialogue and nothing should be raised for the first time when the progress check is taking place. Observations and assessment, ongoing observations and assessment inform the report. It's not something we need to evidence separately. It's part of everyday day-to-day assessments, conversations, observations that inform our practice. We shouldn't be doing any extra observations to inform the check, and we should be focusing on what the child can consistently and independently do. So how are we engaging parents and carers in the process? Working with parents is vital, and this partnership starts from the moment they join our setting. So how actively engaged are our parents with the check, and how are we making sure it's useful to them, helping them to understand their child's achievements, developments and need? Are we working in partnership with other professionals? Are we asking for the 2-year-old health review, the ASQs? What are we doing when there's a significant concern? Who do we need to talk to? And have we developed a targeted plan to support the child and involve other professionals? So the progress check aims to promote positive outcomes in health, well-being, learning and development, and facilitate appropriate interventions that support children and their families. So the progress check aims to review a child's development in the 3 prime areas of the EYFS, ensure that parents have a clear picture of their child's development, enable practitioners to understand their child's needs and plan activities to meet their needs in the setting, enable parents to understand the child's needs and with support from practitioners enhance development at home, note any areas where the child is progressing well and identify areas where progress is less than expected, and describe actions the provider intends to take to address any developmental concerns, including working with other practitioners where appropriate. So when is the progress check completed? So the progress check is carried out any time between the child's 2nd and 3rd birthday. Wait for the child to be settled, so give them half term, 6 weeks. You may need to be more flexible during the pandemic. Make carers and parents and carers aware that the progress check will happen when they join the setting. Request ASQs from the child's health review, so during the settling in transition to nursery process, if it's already been completed. Or ask parents to notify you when the health review will take place so that the progress check can be completed beforehand and shared at the health review. Does the ASQ show if a concern of development has already been raised? And is the child already known to the health visitor? So this may be the case where the child has more complex needs. So who completes the progress check? So this is usually done by the key person. It needs to be done by a staff member who knows the child best. So you work with the team, with parents and the SENCO where appropriate. Create a dialogue, so based on what you know about the child from observations and contributions of parents and other professionals where needed. The manager should read and check the progress report before it's finalised to ensure it's robust, know about concerns and actions, and also check for spelling and grammar. So how is the progress check completed? So on the hub, you will find a flow chart so illustrating the stages that we recommend you go through, and also progress check performers and examples to ensure that settings are EYFS compliant. So the flow chart that's found on the hub is in line with the Foundation Years Know-How Guide. Print it out, pin it up on the staff notice board, become familiar with the sequence. So where a child has more complex needs, practitioners will need to follow a slightly different path, involving the SENCO, using the STEPS assessment, maybe having more conversations with the parents. There's a webinar on the hub guiding you through the STEPS process as well. I'll be presenting a picture that is a true reflection of each individual 2-year-old. So using practitioner knowledge, ongoing assessment gathered over time, so cross-curricular. Most observations will include some aspect of listening, speaking, understanding, personal, social, emotional development, and refer to the characteristics of effective learning. Is there a mixture of child-initiated and adult-guided observations? Using views and information from parents, so those ASQs, but also those daily informal chats that you have. Observations based on what the child can consistently and independently do. Child participation, so observations that focus on child-led experiences that capture their interests, their ways of communicating, their ways of approaching and doing things, how they talk, communicate about what they're doing. And assessing in partnership the views of other practitioners and professionals that know the child well. So do our progress checks sound different for each child? Children may be operating in the same developmental stage and age band, but all children are different with different interests, schemas, needs and experiences. Reports should not sound the same for each child. We should be drawing upon a rich range of ongoing observations that focus on the primary areas of learning and writing engaging, personalised reports. So we're considering the language that we are using in our observations and our progress checks to describe the child, and how is the language we use building a picture of the individual child. Pause the webinar and discuss how and who you are working in partnership with and what this looks like in your setting. So think about parents and carers, professionals, the health visitor. But where possible, the health check will inform the progress check or vice versa, depending on what's happening first. Make parents aware that you'd like to know when the child's health check is due. This is key as it will give the key person enough time to complete the progress check. We should be encouraging parents and carers to share their child's progress with the health visitor at the health check, because it will give the health visitor a more in-depth knowledge of the child's learning and development. Pause the webinar and take some time to think how and who you're working in partnership with. For any assessment of development to be meaningful and useful, we should gain a complete picture of the child. Parents have in-depth knowledge of their child's physical, emotional and language development over time, and research confirms that sharing of regular two-way observations on learning and development with parents leads to improved cognitive, social and emotional outcomes for children. So together, parents and practitioners need to be reflecting on what the child likes to do, what they're trying to master or have just learned, new words and language structures that are emerging, any particular interests or patterns, so thinking about the schemas and explorations that are observed, and agree targeted actions at home and in the nursery. So just thinking about how we're communicating with parents who maybe need a little bit more or a lot more support. The progress check must indicate if a child is not making expected progress and state what support you intend to put into place. When children with speech and language disorders and delays are identified earlier, they make faster progress and have a better chance to catch up to same-age peers. So does the check describe actions to be taken to address any developmental concerns, including working with other professionals where appropriate? Is it signposting families to the children and family centres and websites such as Hungry Little Minds, Tiny Happy People, to the Chit Chat Pitter Pat and the Learning Together activity cards that can be found on the Hub in the Working with Families Birth to 5 section? When completing the progress checks for children with additional and complex needs, there are tools available on the Hub to support. The STEPS assessment is a tool used for assessing and monitoring development progress for children 0 to 5 with additional needs or disabilities. There's a webinar and documents in the Send Passport area on the Hub. ASQ, so ask to see the child's ASQ if the health check has already taken place, as it will have useful information to support your assessment and to know what support the family may already be receiving or waiting for. Some children may already be known to the health visitor or services from birth. The parent partnerships and those ongoing conversations. So potentially there's going to be difficult conversations and messages to share and have with parents. So it's important to seek the support of your manager, SENCO, and the team so that you're well prepared where there is a concern over a child's developmental progress. Conversations should not be in isolation, so completing the progress check should not be the first time a parent carer is hearing about the concerns over their child's development. Keep talking from the parent from the very beginning, sharing the child's achievements, the wow moments, as well as those concerns that you may have. And seek parental consent when working with SENCO, developing support plans, specific targets, and SENIF funding. Seek advice from your area SENCO. Do you need to apply for SENIF funding, which can support additional resources, training, or anything that supports the child? Support plans should have targets that are clear, specific, appropriate, and reviewed regularly. So what next? What are you going to do with the information generated in the progress checks from your observations and assessments? How is it influencing your environment, the provision, the curriculum? And how are you using this information to support the home environment and empowering parents to support their child's learning and development? Pause the webinar to reflect what is happening in your setting, what is already in place, what procedures do you have to support with early identification and raising concerns with parents, and what else do you need to be doing? Where a progress check is being carried out on a child who already has an identified disability, medical need, or specialist educational need, are the views of relevant professionals sought? Does the check focus on what the child can do, their unique and individual characteristics, and their development to date, rather than describe the development in terms of their need or disability? So does the progress check give parents a clear idea of how their child is developing and how their child's development will be taken forward in the setting? Does it provide manageable suggestions for parents in supporting their child's development at home? And where actions are noted for parents or the settings, are targets reflective of the concerns raised, and is this embedded into the planning? The targeted actions should identify emerging learning needs and target appropriate interventions, should focus on educational outcomes rather than a description of activities that you intend to do. But for parents, you might want to give them ideas on simple, easy ways to work on the targets at home. They should focus on prime areas of learning and not, for example, target colours or counting. And they should be specific, so identifying a clear learning outcome. So if, for example, to increase Jack's range of 2 and 3 word phrases rather than to support speech and development. So what kind of words do you want Jack to be using? Are they action words? Are they naming words, for example? So are we getting it right? So take some time with your team to reflect and consider the following statements. So are the progress checks clear and easy to read and understand for parents? Do they present an honest yet sensitive reflection of what the child can do? And, if necessary, identify where the child is progressing at a slower pace than expected? Does it reflect the child's individual characteristics, personality, and growing ability? Does it recognise parents' in-depth knowledge of their child by incorporating their observations and comments? Is the progress check drafted and shared with parents before it is finalised, with agreed targeted actions at home and in the setting? And do the targeted actions focus on an educational outcome rather than planning of an activity? To see how well your progress checks paint and create an individual picture of each child, a useful task to do as a team: read your progress checks with the team together without naming the child. Can the team guess which child you're talking about? Why? What is it that you've included in that report that really paints a personalised account? What have you included that makes that child stand out? So what are you doing with the information gathered in the progress check? How will you be implementing actions identified to support the child and their family, including referrals and signposting to further support? What will you put in place to support 2-year-olds who need extra focus? And what support are you giving to empower parents to support their 2-year-olds' learning and development at home? So it would be useful for settings who wish to really focus on the effectiveness and quality of their progress checks to reflect together as a whole team and create an action plan based on the following points. Are the progress checks based on ongoing observations of the child's interests, achievements, skills, knowledge, and behaviours that the child demonstrates consistently and independently? Is the child's development being reviewed in the 3 prime areas of the EYFS? Does the progress check refer to the characteristics of effective learning? Is the information gained during the progress check being used to inform the 2-year-old provision? And if so, in what way? The progress checks should truthfully and sensitively record the development of any child with an identified disability, medical need, or special educational need. Does the check focus on what the child can do, their unique and individual characteristics and the development to date, rather than describe the development in terms of their need or disability? Who's involved? Are there any concerns raised, being followed up with other relevant professionals? Are the progress checks clear and easy to read and understand for parents? So avoiding unfamiliar jargon or terminology. Is translation offered? Does it give parents a clear idea of how their child is developing and how their child's development will be taken forward in the setting? Does it provide manageable suggestions for parents in supporting their child's development at home? So early identification is crucial, and early intervention and working in partnership can make the difference to the outcomes of the young children that we work with. Resources referenced in this webinar can be found at these links on the Hub, and you'll find them on the assessment pages on the Hub, and there's a section for the 2-year-old progress check. Likewise, with the STEPS assessment, you'll find this in the Send Passport area on the Hub. We'll be running the Being 2 project each year, so this training is part of the Being 2 project. Further information can be found here on the Hub and on the Being 2 page on the Hub. And if you're interested in taking part in Being 2, please email EY Training to share your interest. And there's also a link here to the Foundation Year's Know-How Guide to the progress checks. Thank you for thinking more deeply about the progress checks at age 2. All the resources referred to in this webinar can be found on the assessment pages of the Hub. And please contact eytraining@walthamforest.gov.uk if you require further support with the progress checks.